Hi guys, it's me Lindsay with EquipMeOT here today to talk about another slide board transfer. If you caught my last video, I went over how to slide board from the bed to the wheelchair and back again, and today I'm going to be talking about toilet transfers using a slide board. Now this is a very complicated transfer and requires a ton of practice. I entirely recommend that you focus on doing this with a healthcare provider, somebody trained in this, so you can practice it a lot before you attempt to do it independently. Most folks require assistance with this transfer, so in this situation, I'm going to demonstrate it on myself, but for you, you will likely need a caregiver to assist you. So, the toilet transfer with a slide board is typically not done in the bathroom. Most often it's done at the bedside or using a bedside commode because of the flexibility that a commode offers you, whether it's a rolling shower commode or a standard commode. These are the best places to start when it comes to doing your toilet transfers. Likely you're working with somebody who perhaps has multiple trauma, lower body injuries making them non-weight bearing, perhaps a spinal cord injury, brain injury, or stroke that makes being up on their legs nearly impossible or very unsafe. So oftentimes the toilet transfer with a slide board is the first opportunity for somebody to use a toilet that isn't from the bed level. So they're usually a little bit nervous. There could be some vestibular components to it. So just be very aware that this transfer is going to take a lot of time and patience to get used to. So some of the supplies you'd need, if you're doing it from a commode level, you're going to want a drop arm variety of commode. I'm going to show a picture here. This type of commode is going to give you the greatest surface area and the flexibility of the removable armrest. This is going to help immensely in creating the most direct, straightforward transfer on and off of the commode. Very comfortable with the padded seat, and it's going to be very stable. Very easy for the caregiver as well as for the client who's going to be doing the transfer. Another option is a bariatric commode. Bariatric commodes have a nice wide surface space so that there's a lot of positioning options for the slide board. Again, this is going to give you a lot of opportunities to set up in different ways so you get the right setup for your needs. Now, we're in the bathroom here, which in some situations this is going to be available to clients depending on how big their bathrooms are, how set up they are to accommodate a wheelchair. In my situation, I have just enough room for a wheelchair and a raised toilet seat on my toilet. And I'm going to show you how to do a slide board transfer using this setup. This is a clamp-on variety raised toilet seat, and as you can see, it has a large amount of plastic surface area here, so I have extended points beyond the actual toilet seat space. This is important again because when you're using a slide board, you want a lot of surface area to set the slide board on. It's also flat compared to the concave nature of a traditional toilet seat, which can make the slide board tip awkwardly and potentially cause people to lose balance, even fall, which we certainly do not want. So let's just show you how you'd go about setting this transfer up. First things first, setting up the wheelchair. You're going to approach with a 45-degree angle to the toilet. So between the wheel and the toilet, you want roughly 45 degrees. You're going to need to get the footrests out of the way. So one side can simply be flipped up out of the way, the side that's away from the toilet. The side closest to the toilet is actually going to need to be removed. So that one will just lift up and out of the way. Don't take it too far away because you're going to want it back when you get back on the toilet or on the wheelchair. The next thing you're going to need to do is you're going to need to get the armrests out of the way. This one and this one. So most of these raised toilet seats that have armrests, the armrests move very easily. This one is exceptionally easy. It's a simple push pin. So I got that out of the way. So now that I have a free gap between me and the raised toilet seat. So setting up your slide board. I have a standard slide board here. You want a relatively short slide board for this transfer unless there's a space issue that requires you to be at a greater distance from the toilet, but shorter is typically better. I also recommend having a small piece of Dycem nearby. This is a bit of a pro tip. Dycem is a double-sided sticky silicone that allows you to put it on what is a very slick, smooth plastic surface and a very smooth wooden surface, and when the two of them meet, you tend to get a lot of movement. So what I like to do is put a little bit of Dycem over top of the plastic, and this will help the slide board grip so that you don't run the risk of it sliding as you slide off the seat. Now, when I'm going to position myself, I'm going to lean away from the toilet, going to take the slide board, it has a handle here, and I've got this angled piece here, so this is going to act like a wedge, and it's going to go under as far as I can under my backside. I would strongly recommend you consider your lower body dressing at this point. You want to make sure you're wearing something easy to remove, but that covers you to the hip, below the hip, because if you try to do this in just a brief or underwear, too much skin is exposed and you tend to stick. So having something that covers your backside but is easy enough to remove once you get over to the toilet is perfect. Okay, so back to the slide board. We're going to insert the wedge underneath our hip as far as we can. Okay. And then we're going to simply, now you can see I have a little bit of a height difference between my seat cushion and this. And as you go, and this is where your caregiver is going to need to be keeping a close eye on you, make sure that you can get past the wheel, which is behind me. You're going to move slowly. If you had a caregiver, they'd be in front of you helping you slide across. Pressing slowly. I can use this other handrail all the way down onto the toilet seat. At this point then, we would pull this out. You can remove the Dycem if you want. At this point, you can then pull your pants down. What you need to be able to do is lean side to side quite far to be able to pull your pants down off your hips. So if you can, have something loose fitting, easy to slide out from underneath you so that you can then use the toilet safely. Do your business, and then you're going to have to pull those pants back up. This is going to be the harder step. Pulling pants back up over your bottom after you've toileted is not easy to do. You're going to have to lean really far to the side and allow the caregiver to assist you. If you're dealing with somebody with a lot of balance issues, maybe some cognitive issues, this is probably going to require possibly a second set of hands. So don't be afraid to ask for that when you're early on in the process of learning how to do this type of slide board transfer. Like I said, it's a complicated one and it requires a lot of practice. Okay, so let's head back to the wheelchair. Again, we're going to take the wedge piece here and we're going to insert it under our hip. I'm going to pull myself over and I'm going to stick it there. And again, the complicating thing here is because of the wheel on the wheelchair. So you saw I had to kind of slide it around to get that angle. We want to go kind of beyond the beyond the wheel. You can see I'm going uphill a little bit. So this is where where the caregiver is going to have to do a little bit more work to help you get up that hill. And you're going to have to push. That's where this handle comes in really handy. So we're going to begin the process. Slide, slide. We're getting over the wheel. Slide, slide. Okay. And just like that, we can remove the slide board. So, as you can see, the slide board transfer on and off of a toilet is not an easy transfer, but it is essential in a lot of situations during lengthy traumatic recoveries. And it is for some folks the only way to safely transfer on and off a toilet. So I hope this information is valuable to you. If it is, give me a thumbs up. As always, leave your comments and questions down below. And if you want more information on how to stay safe and independent in your own home and community, consider subscribing to EquipMeOT. Thank you.